Welcome to the Maternity Mentor. Today we will be talking about medications that can be prescribed for perinatal mood disorders to help you feel better. Stay with us. Hi, I'm Samantha. I've been a registered nurse since 2009, working in mother-baby postpartum, NICU, antepartum, and labor and delivery. I'm also an IBCLC. I'm maternal newborn nursing certified, and I've received training in perinatal mood and anxiety disorders, as well as perinatal bereavement. Perinatal mood disorders affect 10 to 20% of pregnant and postpartum women. These disorders can have devastating effects on the family as well as the mother-baby relationship. Medication can be a safe and effective way to treat these diseases, which can improve outcomes for both mother and baby. The following is a guide to medications that you can speak with your healthcare provider about and does not replace the medical advice of your provider. Do not start any medications without discussing it with your provider first. They know your health history and any underlying health conditions that might make these medications contraindicated. However, this video is intended to provide you with the names of medications you may want to consider as part of your treatment and can give you specific information to talk with your provider about. Let's explore what medications can be used for perinatal mood disorders. Perinatal mood disorders range from anxiety and depression to PTSD and OCD. Treating these disorders is essential for everyone in the family. For mild presentations of certain conditions, simple therapy and self-care may be enough. If the presentation is moderate to severe, or if the mother has a mild presentation with a history of mood disorders, medication may be the best treatment. Contrary to anecdotal reports, women can take many medications safely while pregnant or breastfeeding. However, choosing to take medications is a very personal choice that depends on many complex and personal factors. No matter what a woman chooses to do, she should feel supported in her decision to use medication or not. The following presentation of medications should be considered a guide. All of these will need to be prescribed by a healthcare provider who can monitor you and ensure that it's the right medication for your care. SSRIs are also called selective serotonin reuptake inhibitors. They are a first-line treatment for perinatal depression because they are one of the most studied classes of medications. A bonus to these medications is that many of them may also assist in treating anxiety. First is Zoloft, also called sertraline. This is the most commonly prescribed SSRI to pregnant and postpartum women because it has the most study data available. It is also prescribed often because it is indicated for use in both anxiety and depression. Very little, if any, Zoloft will enter a mother's breast milk, which makes exposure to the baby minimal. Zoloft can be prescribed starting as little as 12.5 milligrams per day and can be increased up to 200 milligrams per day. Other SSRIs that can be considered are Celexa, Lexapro, Prozac, and Paxil. Of note, Paxil is rarely prescribed because it was thought to increase a risk of cardiac malformation in babies. There have been studies done that now disprove this evidence, but Paxil remains rarely prescribed. Paxil should be considered if a mother has responded well to it in the past. SSRIs can take up to 6 weeks to show full effects. However, some medications may start to work in as little as 2 weeks. Lexapro tends to work a little faster than some of the other SSRIs. Additionally, your provider should start with a low dose and move slowly when increasing your medication to a level that works for you. Hang in there. Medications can work. Just try to remember that they may need some time to reach the levels needed to be effective for you. SSRIs remain one of the most frequently prescribed medications for women who are pregnant and postpartum with anxiety and depression. As such, there have been a lot of data and studies collected on these medications. There has also been reports of some concerns that have been raised that should be addressed. First is the increased risk of miscarriage. Controlled studies have shown that there is no increased risk of miscarriage while using an SSRI. Furthermore, there is an elevated risk of miscarriage for women who discontinue SSRIs prior to conception, which is probably caused by an underlying illness. As indicated previously, there's no increased risk of cardiac malformations with Paxil or any other SSRI or SNRI, which we will discuss shortly. Cardiac malformations occur in 3% of the regular population, and SSRI use does not increase this percentage. There is a slight increased risk of preterm birth by approximately 1 week and low birth weight, which is approximately 3.5 ounces smaller with the use of SSRIs. However, these same risks exist in a woman with untreated depression. There is a risk of persistent pulmonary hypertension, or PPH, with the use of SSRIs. However, there is also a risk of PPH with untreated maternal depression. Studies of SSRI use in pregnancy do not show an increased risk of long-term behavioral problems in children. The risk for developing autism and ADHD is also not increased. This is because studies have shown that SSRIs are not neurotoxic. In fact, untreated maternal depression can be neurotoxic. Finally, SSRIs have been linked with neonatal adaptation syndrome in about 10 to 30% of pregnancies. This is where the baby has withdrawal symptoms after not being exposed to the SSRI any longer through the placenta. The symptoms can start within 48 hours of birth, but they can last no longer than 2 weeks. There is no intervention needed, and breastfeeding may actually reduce the symptoms. Before we continue, please remember to hit the like button and subscribe so you can get our latest content to have a happy and healthy family. Now let's talk about SNRIs. SNRIs are also called serotonin and norepinephrine reuptake inhibitors. This class of medications is considered second line in the treatment of perinatal depression. The most commonly used medication in this class is Effexor or venlafaxine. This medication starts at 25 milligrams per day, but can be dosed as high as 300 milligrams per day. The XR version, which means extended release, is prescribed most often because one pill will last 24 hours. A disadvantage for mom is she can have significant side effects if she misses a dose, and therefore, if the medication proves ineffective, she will still need to be tapered back off of it. In this class, Effexor has the most safety data available for pregnant and breastfeeding mothers. Other medications prescribed include Cymbalta and Pristiq, but they are not prescribed nearly as often. Wellbutrin, or bupropion, is a medication often used in conjunction with an SSRI. It also comes in an extended release formula and should be used first thing in the morning because it provides a lot of energy. If taken at night, it can cause insomnia. It should not be used in someone who has a history of epilepsy or seizures, as well as women with a history of eating disorders. Remeron, or mirtazapine, is another medication used for depression, but it has the opposite effect of Wellbutrin. This medication can also be used to treat insomnia as well as hyperemesis gravidarum. This medication should be taken at night and should not be prescribed to a mother with diabetes, obesity, or hypertension because Remeron can cause increased appetite, nighttime eating, and weight gain. Finally, a new medication that's come on the market is Trintellix. This medication has very little safety data and should not be started as a new prescription for a pregnant or breastfeeding woman. That being said, Trintellix should be continued if this medication already is being used and the mother is stable on it. There are 3 medications that are not benzodiazepines that could be considered for use in pregnant and breastfeeding women for anxiety. The first is Buspar or buspirone. This medication can be started as low as 5 milligrams per day and go as high as 60 milligrams per day. Buspar works best when it is taken 2 or 3 times per day. It's not addictive, and it's a good alternative to a benzodiazepine, but unfortunately, it's not always effective. Vistaril or hydroxyzine is another medication used for anxiety. It's an antihistamine similar to Benadryl. It can be given up to 4 times per day. However, it should not be prescribed to breastfeeding women because it can interfere with their milk supply. Seroquel or quetiapine is an atypical antipsychotic that in low doses is effective for anxiety and insomnia. It can also be given in higher doses for women with bipolar or psychotic disorders. This medication can cause low blood pressure in the morning, so women should be careful when getting out of bed. In addition to these anxiety medications, mothers can also be prescribed a class of medications called benzodiazepines. These include Xanax, Klonopin, and Ativan. These are highly effective against anxiety, but they're also highly addictive. Benzodiazepines should only be used for the shortest time possible, usually to get a mother through crisis. Long-term use is not recommended because mothers and babies can experience withdrawal symptoms when the medications are discontinued. Sleep is extremely important for proper mental health. Unfortunately, insomnia and poor sleep are one of the most common complaints women have. Previously mentioned Seroquel and Remeron can both be used for the treatment of insomnia. The benzodiazepines Ativan and Klonopin have also been used. However, with the high risk of addiction and withdrawal, these are rarely prescribed for the treatment of insomnia. Women with insomnia are often recommended to take Benadryl, which is available over the counter. Dosing starts at 25 milligrams but can go as high as 50 milligrams. The issue with Benadryl is that it should not be given in a breastfeeding woman because it can dry up her milk supply. Additional over-the-counter medications that may be recommended to help with sleep include melatonin and Unisom. Melatonin is available in a variety of strengths and forms, including tablets, gummies, and liquid. Unisom is often used in combination with vitamin B6 as a treatment for morning sickness and hyperemesis gravidarum. Finally, many healthcare providers will prescribe trazodone for the treatment of insomnia. Trazodone can start as low as 12.5 milligrams and go all the way up to 200 milligrams per night. This is a highly effective medication for most people and has an added benefit of helping to treat depression. Side effects can include headaches and morning grogginess. However, there is no risk of addiction noted with trazodone. Perinatal mood disorders can have devastating effects on a mother and her baby, but with treatment, things can get better. I hope this has explained some of the medications you and your healthcare provider can consider in the treatment of your mood disorder. Please remember, you are not alone in this fight. Please share your comments and let us know what topics you would like to hear more about. If you like this content, please remember to hit that like button and subscribe so you can be the first to receive this information. Remember to share this channel with your friends and family and follow us on Facebook, Instagram, and Twitter for additional content. We will link those in the description below. Thank you so much for joining us at the Maternity Mentor.